Greetings, Eric Backer, naturopath from New Zealand, author of Candida Crusher, talking to you from sunny Las Vegas. I'm here for a trade show at the moment, supply side. It's one of the world's best shows for raw natural materials and people associated in the industry. You just missed the siren. I can't get over any sirens in this country. Every 5 minutes I'm hearing a siren. Rear, rear, rear. In New Zealand we hear them every now and then, but here it's like 5 times a day. What's going on here? Maybe it's the same guy driving around the whole day because he's bored or something, I don't know, but it drives me nuts. Anyway, what were we going to talk about? We're going to talk about Candida. You know, there are so many Candida protocols out there. How do you know what's a good one? How do you know what's a bad one? How do you know you're getting ripped off? How do you know someone's got experience to give you advice? Every time I go to YouTube or I look at an internet site, there's millions of professionals out there, people with white coats on and stethoscopes. I can tell you how to cure your Candida in 1 day or 24 hours. You can get rid of your Candida. You know, and there's one guy lying there like this. He's lying there like he's just had a massage on a bed. Let me tell you how to cure your Candida. Man, this guy like he's on drugs or something. Be careful with advice on the internet. Even be careful with the advice I give you, right? I want you to really try things for yourself at home. And a lot of the advice I give you is based on my 30 years of clinical experience, seeing tens of thousands of patients. I've seen now in excess of 40,000 patients in all the years I've practiced. I'm coming very close now to hanging up my white coat. I've never worn a white coat, but I'm going to hang it up. I'm just about done now with clinic because I want to focus more of my attention on protocols and making outstanding educational aids for people like you who are watching this on the internet. I've done my dash. I don't need to really do much work. I sort of just want to slow down a bit. I've been with my wife for 30 years as well, and we want to spend time coming to create. Hear the siren? Can you hear it? Another one. That's the same guy, I'm telling you. He's just coming back again down the strip. He's probably got Elvis sitting next to him. I've seen Elvis twice since I've been here. Would you believe it? I wonder if it's the same guy. Did he really die? There it is. Can you hear it? Crazy. This is a crazy place. So how do you know that you're getting It's loud, isn't it? How do you know you're getting a Candida protocol that's fair dinkum? You know what fair dinkum is in Australian? It means it's the real McCoy. So try and listen to advice from someone who's worked with lots of people with Candida. Try and avoid people, I call them armchair experts, that sit in an armchair and say, I'm an expert, I know everything about it. I'm the first one to admit I don't know everything about Candida. I'm speaking from clinical experience, and I'm speaking from having gone to hundreds of different conferences and seminars listening to experts, working in well over a dozen medical clinics and with a lot of professional people. So I've got some experience, maybe not as good as others out there, but I can tell you something. These are the core things I want you to really think about when it comes to selecting advice from someone who's giving you the advice to help you with a Candida yeast infection. Listen to someone who's done a lot of tests on someone, particularly stool tests. I've conducted thousands of stool tests on patients. I've identified the core 18, 19 species of Candida in patients now over a 20-year period. I've worked with doctors' data since 1999. I've worked with Genova Diagnostics for the same period of time. I've worked with Diagnost Tech Lab in the US for about 10 years. I've used to work with Metametrics. I work with all the labs. So I look very carefully at lab results and I correlate those lab results with patient outcomes. Meaning, got Mrs. Smith over here who's got bloating, farting, burping, a lot of problems, and I've done a stool test on Mrs. Smith and I find that she's got a lot of Candida there. And now I'm going to give Mrs. Smith advice and say, let's retest in 3 or 6 months and see what the outcome is. And then we retest, same lab, same test, very careful how we conduct the test. There are particular protocols. And we find the Candida's gone. And we find that it correlates with her improvement in her health. What does it tell you? And we see that time and time again. It tells you that most probably the advice that Mrs. Smith was given was conducive towards a clearing of the Candida in her body. Right? We're not just making wild assumptions here with patients. When I formulated CanXida Remove, I formulated this product based on over 3,000 stool tests. 3,000! That's a lot of stool testing. So a lot of the information I got from studying tests and patients led me to formulate a product which I think is one of the best on the market for the eradication of not just Candida, but parasites and bad bacteria. And the amazing feedback we're getting from people is a testimony to that. All right? That to me is how you find a protocol that's actually really going to work. So how to sort the wheat from the chaff, how to find the diamond in the in the whole pile of coal, is to keep away from people who say, I can cure you real quick from this Candida. I mean, come on, go and smoke another joint. Don't listen to people that make wild, exaggerated claims. Don't listen to people who say, you can't eat this food, and this is how you gotta do it. So be careful with people who preach, these evangelical, almost like terrorists, like ISIS kind of mentality, where if you do this, you can't do this, and you have to do it like this. I'm not saying my way is the right way, but what I am saying is based on experience. I made a ton of mistakes with patients, but as you get more experience, you tend to make less mistakes. You listen more carefully to people, and you base your protocols on outcomes that have preceded that, thousands of outcomes. So that's how you base things. You get sharper and sharper and sharper, and eventually you tend to have something that's pretty close to being outstanding. And I believe Candida Crusher, when I wrote that, was the result of all these years of work. I'm not saying my way is the highway. There's a lot of highways. But my way is definitely quite a good thoroughfare. I believe that. It's a well-walked path, a path that many people have been on. And it's a path that works for a lot of people. There's a ton of roads that lead to Rome, but usually one or two will give you the quickest route there. And I think mine's one of those routes. So in that, I'll leave you. But please check out Candida Crusher. If you haven't completed my online quiz, probably the best in the world for Candida, you can go to yeastinfection.org and look at that. You can go to candidacrusher.com. And please also check out CanXida.com with an X in it. This has got some pretty good information on why I formulated the stuff I did. I didn't formulate my products to make money. I've made my money out of other businesses. I formulated this because I've got a passion in this business, because I had real bad Candida in my 20s, and I was at a point in my life where I hit such a low point, and I realized I had to do something not just for me, but then eventually I realized I want to help other people out too. Because my dad nearly died because of yeast infection, and I got to a point where I didn't want to live anymore, but fully recovered from it. I was so grateful for that. Through naturopathy, I became a naturopath. It became the focus of my life. It's culminated in me coming to Las Vegas. Next year going to Germany to look further into some of the world's best botanical medicines I can find to create the finest products I can possibly make for people like you. CanXida Remove is an outstanding product, but I want to make it one of the world's probably #1 products in this realm, so stay tuned. Thanks for tuning in, guys. No more sirens. Take care.